spleen. The spleen is an organ located in the upper left abdomen, and is roughly the size of a clenched fist. In the adult, the spleen functions mainly as a blood filter, removing old red blood cells. It also plays a role in both cell-mediated and humoral immune responses. The spleen is located in the upper left quadrant of the abdomen, under cover of the diaphragm and the rib cage, and therefore cannot normally be palpated on clinical examination. The spleen is an intraperitoneal organ, entirely surrounded by peritoneum, except at the splenic hilum. The spleen is connected to the stomach and kidney by two parts of the greater omentum, namely 1. Gastrosplenic ligament, anterior to the splenic hilum, connects the spleen to the greater curvature of the stomach. 2. Sphenorenal ligament, posterior to the splenic hilum, connects the hilum of the spleen to the left kidney. The spleen has a slightly oval shape. It is covered by a weak capsule that helps to protect the organ. The outer surface of the spleen can be anatomically divided into two. 1. Diaphragmatic surface, it is the surface of the spleen that is in contact with diaphragm and rib cage. 2. Visceral surface, it is the surface of the spleen that in contact with the other abdominal viscera. It also has anterior, superior, posteromedial, and inferior borders. The enlargement of the spleen is known as splenomegaly. The splenic hilum is a location on the visceral surface of the spleen. It is the point of attachment for the gastrosplenic ligament, and the point of insertion for the splenic artery and splenic vein. The spleen lies in close proximity to various other structures in the abdomen. Anteriorly, the spleen is related to the stomach. Posteriorly, it is related to diaphragm, left lung, and ribs. Inferiorly, the spleen is related to left colic flexure. Medially, the spleen is related to the structures like left kidney and tail of the pancreas. The spleen is a highly vascular organ. It receives most of its arterial supply from the splenic artery. This vessel arises from the celiac trunk. As the artery reaches the spleen, it branches into 5 vessels, each supplying a different part of the organ. Venous drainage occurs through the splenic vein. It combines with the superior mesenteric vein to form the hepatic portal vein. The nerve supply to the spleen is from the coeliac plexus. Splenectomy is the surgical removal of the spleen either entirely or partially. Despite its important function for the immune system, the spleen is a non-vital organ. The reasons for removing the spleen include extensive splenomegaly, rupture of the spleen, and severe infection. Thank you. The spleen.